New York's order to wear a face covering is now in effect. So this means anyone who's in a situation where they cannot maintain social distance must wear some type of mask. That order took effect just hours after the state released some new information. It paints a clearer picture of the toll this pandemic is taking on New York nursing homes. More than 3,000 residents of long-term care facilities have already lost their lives, accounting for roughly a quarter of all deaths across the state. In the meantime, the more than 1,500 deaths reported in New Jersey's nursing homes amount to just under 40% of total lives lost. More than 320,000 people have tested positive for COVID-19 across the whole tri-state, and nearly 18,000 people have died. News 4's Ray Vieta covering both the pain and the progress in the Empire State. He begins tonight's team coverage live from Bellevue Hospital. Ray.
Natalie, tonight I spoke with a doctor leaving his shift at Bellevue who tells me it is still a war zone inside. He's seeing COVID patients of all ages. And now the city is taking more aggressive action, requiring the use of these masks and ramping up testing.
I'm living in Arizona, having this wonderful life with my kids, and I see the tragedy that's hitting New York City, and I felt like I needed to come help.
For the last 9 days, Dr. Paul Lynch has been at Bellevue Hospital, the same place where he finished his residency. Now back to fight COVID at the nation's epicenter.
Every room, every patient, every interaction, you're around COVID. And I think I felt scared for the first time.
He is among the thousands of healthcare workers coming to our city. This team of 25 nurses and doctors arrived Friday from the Cleveland Clinic to help New York Presbyterian. Mayor Bill de Blasio spending part of Friday night at hard-hit Elmhurst Hospital, thanking those on the front line there. An hour later, a new directive went into effect. The city and state now ordering people to wear masks in public when not able to socially distance. The city, state, and its neighbors now looking to find a way to reopen the economy. That will depend on testing.
There is no way to get back to normal without a huge amount of testing on a citywide level.
The mayor announced on Friday walk-in test sites in the city's hardest hit areas, including East New York and Morrisania.
We want to reach everyone we can reach to keep people safe.
Governor Andrew Cuomo issued an executive order directing all labs to coordinate with the state to ramp up testing.
This is mayhem. We need a coordinated approach between the federal government and the states.
During the governor's daily briefing, the president lashed out, tweeting in part the governor should spend more time doing and less time complaining, adding, "We built you thousands of hospital beds you didn't need or use."
Thank you again, Mr. President, which, by the way, is just doing your job as president. It's not really thank you like you wrote a check yourself. We need help on testing. Provide the funding.
While the fight for testing continues, the battle against the virus rages on. It's fought by thousands of healthcare heroes like Dr. Lynch.
With 5 kids, why in the world would you go, work in a COVID-19 unit? I'm trying to raise children that will run into a fire.
He is leading by example. 3 of those testing sites open today. 2 other ones in Harlem and Queens expected to open on Monday. All 5 clinics expected to get 2,400 tests every week. We're live in Kips Bay tonight. I'm Ray Vieta, News 4 New York.
All right, Ray, thanks for the latest. City Council Speaker Corey Johnson wants the city to close off 75 miles of streets to traffic to allow more room for social distancing. He and Council member Carlina Rivera are introducing legislation that would make way for walkers, runners, and bike riders instead. Johnson says New Yorkers don't have enough space right now to spread out safely. Mayor de Blasio says he has not seen the details of this proposal. However, he has spoken out against street closings in general. He said the NYPD told him it would not be safe.
Natalie, we're going to turn out to New Jersey. The total number of cases in the Garden State nearing 80,000. And right now, about 8,000 people are hospitalized statewide. But the daily growth rate of hospitalizations is actually down to about 1%. And in just the last 24 hours, hospitals discharged nearly 800 patients. Some positive signs there. Another encouraging update. People showing symptoms in one New Jersey community can now receive their test results in just 15 minutes. News 4's Adam Harding continuing our team coverage tonight live from Hoboken. And Adam, you're going to give us a closer look at exactly how this works.
And Stefan, we have been hearing so many stories for the past couple of weeks about how much anxiety there is when you have to wait several days for those test results. Do you have coronavirus or not? Well, at this site behind us here in Hoboken that just opened to the public earlier today, they can now test you in about 10 to 15 minutes for the virus. At Riverside Medical Center, it's the next step in coronavirus testing.
This is a game changer for Hoboken.
The site, which is now open to the public, can provide real-time results in a matter of minutes.
It really ramps up testing in Hoboken. It allows us to have the knowledge and without the anxiety of knowing whether or not you are positive or negative for a period of days.
The mayor says the city's first responders will greatly benefit from this rapid testing. It is another first-of-its-kind measure in the fight against the deadly virus.
We were the first city in the nation to close the bars and the restaurants. We were the first city on the East Coast to shelter in place. We've been very proactive in the measures we've taken in Hoboken.
At Holy Name Medical Center in Teaneck, applause for a 69-year-old patient, finally released from the hospital after a month. Shuming Liu was in a coma and on a ventilator for 2 weeks. Doctors saved him with an experimental drug first used to fight the Ebola virus.
With all the medicine, I believe I won't even see my father again.
But not every battle is won. Late Friday, a sea of police officers joined in a procession to honor one of their own. Newark criminal intelligence analyst Daniel Francis died this week from the novel coronavirus. He received a hero send-off. Meantime, in Woodbridge, progress at St. Joseph's Senior Home. The facility reopened its doors weeks after the virus forced evacuations. Seniors were taken to a facility 30 miles away while cleaning crews got to work.
As you know, we've seen extreme vulnerability of long-term care facilities in New Jersey and nationally with the pandemic COVID-19.
Long-term care facilities across New Jersey are part of a disturbing trend nationwide, with more than 1,500 of our most vulnerable killed by this deadly virus. And Stefan and Natalie, you touched on it at the top of the hour. We are learning tonight that about 90% of those long-term care facilities across the state, they are all reporting some form of COVID cases. As for the testing here, it is the first of its kind regionally. We're live tonight in Hoboken. I'm Adam Harding, News 4, New York.
Adam, thanks so much. Let's move on to Connecticut now. Nearly 17,000 cases of coronavirus. The death toll just rose to over 1,000 people. Officials in the state say around 80% of people who died were at least 70 years old. Fairfield County, still the hardest hit area, more than 7,000 cases there.
President Trump is coming under criticism tonight for retweeting the words of protesters who want stay-at-home orders lifted. In separate tweets, the president said, "Liberate Michigan, liberate Minnesota, and liberate Virginia," linking the shutdown in that state to gun rights. All three of those states have Democratic governors. When asked about those tweets tonight, the president said those governors have, in his words, done too much. Well, the president also defended the nation's coronavirus testing system tonight, calling it great.
Yeah, and he added that he thinks testing is not the most important issue when it comes to reopening the country. He said that the nation's governors are responsible for implementing the testing, not him.
In the next few weeks, we'll be sending out 5.5 million testing swabs to the state. Swabs can be done easily by the governors themselves.
At tonight's briefing, the president also said he is excited about 35 different therapies and treatments that are currently the focus of clinical trials. Wall Street today rallying. The markets reacting to positive news about a treatment for COVID-19. The drug called remdesivir. The Dow Jones Industrial Average rose 705 points, closing back above 24,000. The Nasdaq also up nearly 118 points. The S&P 500 up 75.
A medical student from the Bronx turned his experience with coronavirus into a chance to help others. Haim Rudy says he had a mild case of COVID-19. Well, after he recovered, he heard that he could donate plasma from his blood to help others who are sick. So he contacted Mount Sinai, and they coordinated the donation process. He said it took less than 2 hours.
So they took about 500 milliliters of blood, and then they centrifuged out the plasma, which contains the antibodies, and they returned the red blood cells back to me. And I was totally fine right after, and it felt great to be able to give back in this way.
Now, the New York Blood Center facilitated that donation. Haim says that he's just glad he's healthy enough to be able to help. So kudos to him. All right, a warning tonight from the World Health Organization about coronavirus antibody testing. We've been talking so much about this. They say there's no evidence the test can show whether a person is immune or is no longer at risk of getting reinfected. But what it can determine is whether someone has had the virus in the past and was either asymptomatic or recovered. Scientists are still trying to figure out how long the antibodies could protect people who've already contracted the virus, Stefan.